Hi, this is Stacy McCauley with InspiredHygiene.com. Today we're going to talk about a communication concept, and it really revolves around gaining a know, like, and trust factor with your patients pretty quickly and making sure that we always communicate that we're validating and listening to the patient's perspective. So I was recently working with a new client, and one of their concerns was, how do we communicate this new, much more progressive perio protocol to our patients when we have 5 different hygienists? We're just afraid that maybe one of our hygienists is going to communicate it one way, and maybe the other hygienist is going to communicate it in a different fashion, and we're not going to have that consistency. And I agree, that's a concern, because if you don't have consistency in your messaging, what can end up happening is you will have maybe some of the hygienists in the practice that are a little less progressive. They can be seen as kind of the good cops. They're the ones that always talk about fun stuff, and the patient always leaves with a good checkup. They're probably not quite as progressive as some of the other hygienists in the practice, and so the other hygienists in the practice can then be perceived as the bad cop, because they are the ones that always talk about the clinical findings, they are the ones that talk about areas of inflammation, and they're the ones that are likely to recommend much more progressive periodontal therapies. So what ends up happening is the patient's sitting there wondering which hygienist is right and which hygienist is wrong. And that's never a good situation. I don't think the patient wins when there's that doubt of which one's right and which one's wrong. And I don't think it's fair for us as a practice to be able to practice much more comprehensively when we're inconsistent. The other thing we talked about just a moment ago was making sure that we communicate to the patient that we are listening to them and that we validate them. So a scenario that I learned years ago when I attended a workshop by the JP Institute, it stuck with me then. I use it with my patients, I use it when I teach at the dental school, and I certainly use it when I work with private coaching clients. So if a patient starts to push back a little bit, and they start to doubt you. So let's say this example. Let's say the patient says, Stacy, my gums never bleed at home. They only bleed when you jam that pokey thing in there. So when a patient says that, they're doubting us. And so instead of us saying, no, let me show you, because that's going to be perceived as you don't believe them. So if the patient says, my gums never bleed at home, they only bleed when you jam that pokey thing in there, we need to simply say, you're right. It looks like you're doing a nice job keeping things clean at and above the gum line. But my instruments can access areas deep below the gum line where you cannot reach. And that's why it makes sense to me that you're telling me your gums don't bleed at home, but they're bleeding here today. And that's a sign of active infection and inflammation. So if we can respond with, you're right, it helps relax the patient and they feel like they've been heard. And I think you're going to get much bigger wins with case acceptance when patients hear that. And folks, even if their mouth is a plaque fest, there's really no point in arguing with them if they say, my gums never bleed at home. Just let it go. And what we want to do is validate them. You're right. But you need to follow with our explanation of why the bleeding response is present today. So if some of you think these kinds of communication concepts are an area of opportunity for you and your practice to grow, I encourage you to sign up for our monthly Inspired Hygiene High Profits Mastermind group. This is a group where we get to schedule private coaching time together, and I can work with you and your team on just kind of tweaking your languaging a little bit so that you can get higher case acceptance, you can build know, like, and trust with your patients. We don't give you scripting, we just give you some really practical ideas so that you can implement and influence patients to an even greater scale than you've done in the past. So if you're interested in taking a look at that, it's www.inspiredhygiene.com/mastermind. Thank you so much for your time and have a great week.